Hi folks, I'm Shanahan and welcome back to RecSport Education. Today's kinesiology episode comes courtesy as a request from one of my very good friends. We trained together, we served together, we've basically been through a lot of sweat and pain together. He's a great friend and he has reached out to me asking about methods to help him out. He says his dad is having some trouble with his neck. And I am happy to oblige. In fact, I told him, it sounds like a good opportunity for a video. And that's what we're going to do today. So I'm going to give you some pointers. And because I don't know exactly what's going on with him, I'm going to make this a general video. It'll cover a lot of information. So I'm going to give you a bunch of different techniques that you can do to help with muscle tension and pain in your neck, and maybe help out with some other aspects of the body. So let's get right into it. Sarah here has been gracious enough to volunteer to help us out with this. Hi, Sarah. Thanks for your help. So there's a few principles I want to cover here. First off, there's a lot going on in your neck, obviously. We've got a lot of connective tissue. We have bone, ligaments, tendons, muscles, nerves, as well as a number of blood vessels and, of course, the major arteries. So we want to be very careful on anything that we do with the neck. I'm going to start off with showing you a basic massage technique that's going to massage the lateral side of the trapezius. Now that's a very large muscle that runs from the base of the skull down the neck and across the shoulders and continues also down part way of the spine to the middle of the back. So very, very large muscle, and there's a lot of other stabilization muscles underneath it that we're going to be working with as well. So the first thing I'm going to do is I've got Sarah here laying down on her back. Try to get her as comfortable as we can. And what I'm going to do is stretch this area, or assist her in stretching the area, and then I'm going to apply some pressure. Now, as I do this, I'm going to use some massage oils. Now, you can get massage oils pretty easily. You at least order them on Amazon, but I at least recommend you use something to help make the action more smooth across the skin so that you're not irritating the skin so much and making it red and raw. Now, when you're picking a lotion to use for some kind of massage, there's all different kinds available, but generally speaking, unless you're going for something very specific, I would try to find something that's non-scented, doesn't have a lot of extra stuff in it, it's very basic. You can use lotions too, but I would avoid lotions, especially those that have petroleum bases in them. The petroleum products tend to dry out your skin over time and can cause irritation, especially if you have already a pre-existing skin condition, some sort of rash or allergy. What I'm going to do now is elevate her neck slightly, and I'm going to bring one arm underneath. I'm going to take her shoulder, and I'm going to let her head rest across my forearm. Now this is going to cause the neck to fall with the curve of the cervical spine in a way that will cause these muscles to stretch. So she's relaxing her head across my arm. I don't want her to help me in any way when we do this. I want her to be completely relaxed. And I'm going to then elevate my arm just slightly, and this will cause these muscles to stretch. You can see this tendon right here now quite prominent. And again, she's just going to relax and let her neck fall with that curve across my forearm. And this is going to expose these muscles. Now I can see the head of the trapezius right here. And I'm going to follow that down the length of the neck with my thumb. The idea here is I'm trying to get some more stretch into this muscle and putting some pressure there and just stretching it out for her. Now I can increase this curve as needed. Just get a little more leverage on her shoulder and just allowing some pressure there. Now only talk to the person that you're doing this to and make sure that they are comfortable and that nothing is pulling too hard. How is that?
That's fine.
Is it comfortable enough?
Mm-hmm.
Great. Okay. So then you can use the ear as a reference point, you want to go just behind this bony protrusion behind the ear. And this is going to put you right in line with the occipital bone, which is right under here. That's you're going to feel two different types of tissue here. You've got bone, and then right below it, some soft tissue. And we're going to be working in this area. And I want to stay on the back side of the muscle. There's a lot of nerves and blood vessels in this part of the neck, and it's not going to do them any good to massage this area, and you could damage the area. So we're going to avoid that entirely. And instead, I'm going to stay on the back side of this muscle, right here, you can see, and working my way down and putting pressure then across the shoulder. And again, I'm staying towards the back, so I don't want to be close to the collarbone. I'm going to avoid that. I'm going to go behind it. And you're just going to stay in between the bony places. So you'll see I've got my collarbone here. And on the back side, I have the top of the shoulder blade. And I'm going to stay right in between there where that soft tissue is. So then we'll just do this several times. Be careful not to pull her hair. And I'll give you another angle on this, doing it on the other side. Again, lifting the head slowly, allowing her head to fall. Assist her with that. I'm going to lift my forearm a bit, causes the stretch. Staying on the back side of this muscle. Working down into the shoulder and across the shoulder. Staying in between those bony spots. And this will really help stretch out those muscles. And stretching really helps, but sometimes stretching just isn't enough, or you can't quite do it yourself very easily. So this is just giving you an extra good stretch, and then some working of those muscles to help them work out. Now this is different than the philosophy that you would find in other types of therapies, like chiropractics, for example, which is a philosophy of forcing areas that are out of place back into place. And this can, of course, cause a little bit of trauma to the area and inflammation as a result. Massage, on the other hand, is a very good therapy and has been proven to aid in the healing process and speed of recovery. And it does so by gently encouraging the body to go back to its rightful place. It helps to work out the knots in the body and any extra fluids that may be building up in those areas, and encouraging circulation so that the body can heal itself. Okay, so I'm just going to put her down gently. Nice. How was that? Good start? Right. Doing good still? Okay. Now for this next part, I'm going to show you two methods. First thing I'm going to do is cover the other portion of the trapezius. Remember I said that it extends down towards the middle of the back as well. So we're going to work that out, as well as some of the stabilization muscles like the rhomboids, major and minor. And those are in the middle of the back between the shoulder blades. So what I'm going to do is have her in this position. I'm going to work my hands and fingers under her shoulders to that center part of her back on either side of her spine. So not on her spine. I'm going to avoid that. And I'm utilizing her own weight to facilitate the pressure that I'm using to pull across this muscle. So you see I'm just dragging my hand across that muscle. And I'm using my fingers, a little bit of pressure in there to do this. And it's okay, you don't have to help me. Right, I'll just get under there. I want her to stay relaxed. And I'm just pulling along the sides of the shoulder blades and working my way up. How's that feel? Yeah, really good. This is really good. Right. Now I can brace myself here on my elbows. And this will give me a little bit more leverage and comfort, so I'm not hurting myself. There are a number of ways you could do this, but I'm just using the way that works well for me. I like using my fingers in this case because I can feel a little bit better where I'm at and what I'm doing. There are other methods you can employ. For instance, massage therapists would use their the palms of their hand, the meat of the thumb, the wrists, and even forearms in different methods to get these areas effectively. But they have to do it all day long, and they need to be able to maintain that kind of strain on their body. So they have these methods that protect them. And they're well practiced, so they're able to do that well. So unless you're well practiced, I wouldn't recommend trying to use these other compensatory methods that are very good techniques if you're having to do this all day for a job. But for this, I want to feel what I'm doing and make sure that I'm not hitting anything I don't want to hit, or putting too much pressure in there. So this is going to help me with that. And there we go. So we'll do that for a good 5 minutes would be good. You don't want to overwork any muscle with massage, because afterwards, by the next day, you're going to feel pretty beat up, might even bruise, and that's not going to help you either. That's going to just give you a different condition that your body's going to be trying to recover from and heal. So we just want to stimulate some circulation in those muscles. We want to create some relaxation for those muscles, and maybe work out a little bit of the tension in those muscles, but we don't want to go much further than that. Now, one of the other methods that I have here I wanted to show you is working in the occipital bone. You'll find that just behind the ears and back underneath the skull. So it's going to be right here, just under the hairline. Now, this is a good area to work in because there's a lot of tension that sometimes builds up in here, and people get headaches from this spot, and they tend to travel from the back of the neck through the occipital bone and up the skull and behind the eye. I've gotten those in the past, and I know they can be a real headache, for lack of another word. So we're going to work this area, but there's a few things we need to keep in mind, and one is, it's a little bit hard to identify where you're working all the time, and hard to working because we don't want to pull the hairs. So I don't want to just rub around this area a lot. That's going to be uncomfortable. So what I want to do instead is maybe just put some pressure here. So what I'm going to do is lift your head slightly, and I'm going to use my fingers up underneath the occipital bone. So I'm going to put pressure on that trapezius, and I'm going to follow it up until I just get underneath the bone. And that'll be the occipital bone. And I'm going to let her head just sit there. And I can rest in this position. And how's that feel? Pretty good. Yeah. Pretty good, she says. And so I'm just letting the weight of her head put the pressure on there. I'm not putting really any more pressure, although I can pull into that little empty space there underneath the bone a little bit to give a little bit more pressure, but I'm not really doing much more than that. And you can sit and hold this for quite some time. I'd go maybe a couple of minutes, and just to let those muscles begin to relax. The idea here is that we're trying to cause a chain reaction of putting pressure here will cause the other muscles below it to relax a little bit. When we're finished, we'll just slowly let her head settle. And I don't want her doing any of that work herself because, again, we want these muscles to stay relaxed. So I'm going to do the work for her. How's that? Now, there's another area to consider, and that is how we sometimes get tension from the muscles in the front of the body affecting the back. So what I'm saying here is that we sometimes gather tension in the shoulders, which are being pulled in from the pectoralis major and minor. A lot of people don't realize, but there is a smaller muscle of the pectoralis that runs across the collarbone, and into the shoulder, in the pocket of the shoulder right here. So what I'm going to do for this is I'm going to follow from the sternum and across just underneath the collarbone, across the upper chest, and into that pocket of the shoulder, where what we call the glenoid fossa would be. And you can do this a few times. You're going to find more of the muscle's effect and pressure towards the shoulder. And so you can just work in that area. And I'm just going to kind of stretch out those muscles, slowly working that area. How's that feel? Pretty good. All right. This area tends to be neglected quite a bit. And so I'm going to show you some additional stretches for everything that we've covered so far that you can do on your own. Now, I've also covered these types of techniques and other stretches in another of our videos. It was our top 10 neglected muscles of the body and chronic muscle pain and how to deal with it. So you might check that out. I'll put a link down in the description. Now, when it comes to muscle tension and soreness or whatever it is going on in your neck or in your back or shoulders, you also might consider using some sort of tool. Of course, there's a variety of tools out there. Most of them are probably junk. You probably don't need to waste your money on it, like getting electric vibrating tools that pound on your back. They're really just going to cause more trauma by pounding that muscle rather than working it out and allowing it to relax. So maybe those aren't a good option for you, but some acupressure type tools might be effective. And so using pressure to cause the muscle to release. What happens when we get knots is that the muscle is overworked or has been hyperstimulated, and it causes it to tense up. Think of it like a computer that's frozen. Too much information, it wasn't able to process effectively, and so it freezes while it's trying to work things out. And sometimes it's not able to, and it just stays frozen, causing the need for an immediate reboot. We can do the same thing with our muscles. They are electrically stimulated. So one of the things that you can do is apply pressure to it. This causes a restriction of the blood vessels, cutting off its supply of oxygen and nutrients to the muscle. And after a while, that muscle will sort of relax, or it will go unconscious, essentially being reboot. Once the muscle has reboot, it will relax and it can be stretched and should work effectively again. But this can take some time. Tools like this can be useful. Now, this looks very odd. This is called the TheraCane. And it looks like it's made in Denver, Colorado. It has Denver, Colorado written right there on it. And I thought that was pretty awesome when I saw that, since I live in Colorado. Now, what can I do with this? You're probably thinking that is one crazy looking tool. I would never use it ever. But I actually thought the same thing when I was very skeptical about this. This was given to me as a gift. And I was like, okay, thanks. I appreciate it, but I don't know what to do with it. And it did just hang on the back of my couch for a little while. And one day I had some soreness after a hard workout. I decided to give it a try, and it really is effective. And this is why I can use the different handles on here in different ways to get leverage. So if I'm trying to put pressure on my back, I can literally just hook this on and put that ball right on the muscle that I want to work, and apply pressure to it like this and move it around. And now this allows me to relax my back so I'm not overworking it myself, and I can get some really good leverage, and this is very effective for me at putting pressure there. Now I can use this in a bunch of different ways and positions, and of course using these other knobs can be helpful as well. I can put one of these right on the back of that occipital, the occipital bone I was telling you about, and apply some pressure like so, and just working out whatever kind of tension I'm feeling there, or just allowing it to sit and apply pressure and trying to relax and let that tension fade away. I've really enjoyed this, and maybe this is something that you can check out. I'll do a product review on this sometime, and I'll put a link in the description if you're interested in checking out this or something like it. Additionally, there are massages you can do for yourself. For example, I can work out that pectoralis minor myself pretty easily just by rubbing this area. And that helps with kyphosis, which is the pulling in of the shoulders. And we want to keep those opened up. And so you'll probably want to consider doing some stretches for that as well. Going into a corner and putting your arm against a wall and turning away is a really good way to stretch this. And I've talked about this in other videos before. I'll also put those links in the description. Other things you can do, if you don't have somebody to do that next stretch for you, you can simply turn your head and apply some pressure to that area with your opposite arm to get that extra stretch. And applying pressure here to alleviate some of that tension. And this should be helpful and pretty effective as well. And of course, if you had something like this, you could do that maybe a little bit more easily, just like so. That feels pretty good. All right, so one of the last things I'll show you is a stretch for the upper shoulder. And this should extend partly into the shoulder blade. And what I'm going to do is cross my leg and I'm going to put one arm under. So I've got left arm, left leg, and I am using my leg as a leverage point that I can now pull away from my arm. And this is going to stretch my arm through the shoulder blades. And I should be able to feel this a little bit in the rhomboids and the trapezius, and a little bit here in the shoulder in the front as well. Now, of course, you can switch legs if you're nimble like me. You might have to be a little bit nimble to do some of this. And just to get a different angle, and this I feel more down my spine a little bit further towards the lats. And holding that for about 30 seconds, or just waiting for the tension to release. You can actually feel the muscle begin to relax as you're doing this. So you might just hold it, and it should feel tight, and then it will relax after a few seconds, and then you can slowly release it, and then just work it out. Now, anytime you're working your muscles like this, you're trying to work out some tension, you have some pain, and you're trying to stretch it out, you'll want to drink plenty of water. And if you are using some medications, for example, like an aspirin or acetaminophen, Aleve, something like that, I would encourage you to try to find products that don't have artificial colorings in them. Food colorings are very popular in all different kinds of products, obviously, but they aren't good for you. And you can get colorless medications like acetaminophen that's white instead of red, so that you're not getting that red 40 in your diet, or you don't have blue 1 like you get in Aleve, or any of these other kinds of colors that you find in anti-inflammatory medications. Maybe some final points to cover. Tension in the neck can come from all different kinds of things. Like I pointed out earlier, there's a lot going on in there, so we've got to be careful of it. You can simply rub this area with one hand and just coming across like this. This is a good way to work out some tension. Just moving that together and up. You can also start at the base of the skull, at the occipital bone, and work that area as well. Some other things that may be going on is you'll find tension gathers at the bony protrusion points in the spine and on the supporting sides of the spine. So for example, the shoulder blades, which we have right here, they curve and they go this way and down. At that junction where it begins to elbow is attachment points for different muscles, and they tend to get sore. So we can work out those muscles right there. And I can even just sit and put pressure on it, and that can help a bit. How's that feel? I can tell that's a hard spot, but even more so than the right side. So you can, after a little bit of practice, you can get a feeling for this. This side is pretty soft. There's not a lot going on there, but on this side, right there, Yep, I feel some tension. Oh, I even felt a twinge running right across here as a muscle kind of spasmed a little bit from that pressure. So I don't want to put too much pressure right there. The other thing is you have some big muscles right down here, your lats, the latissimus dorsi, and they have connections up here underneath the arm. And what I can do is grab these, if they're not too ticklish, right? Mind the person you're working on, and I can grab that muscle, and I'm just gonna squeeze it a little bit, and I can even rock it back and forth. What I'm doing is I'm encouraging it to stretch it out, just stretching it a little bit. How's that? If you are feeling some tension there, maybe it's worth spending some time working it out a little bit. Help yourself heal and feel better. Heal better. Okay. Now here's one that's kind of fun for working tension between the shoulder blades. What I'm going to do, I've got Sarah laying here on her side. I'm going to bring her arm behind and bringing my arm through. I'm going to use this to elevate her arm and use pressure with my arm against her elbow to push it out a little bit. What this does is it raises the shoulder blade just a bit. And what I'm going to do here is gently now, because I don't want to hurt her shoulder, right? This is a jiu-jitsu hold, and I don't want to do anything that's going to hurt her arm. All I'm doing is trying to bring this shoulder blade out so that I can get to the muscles underneath more effectively. And what you can do, as you can see here, I can put my fingers all the way underneath her shoulder blade right there. And I can go in here and I can hold this. How's that feel? Pretty good. Pretty good, she says. All right. And I'm going to hold this, and this should help release some muscle tension in that area as well. Additionally, this can help you massage the area underneath the shoulder blade. So I could just run my finger and thumb down this area underneath that shoulder blade. How's that? Really good, she says. All right. So I'm just going to work around the shoulder blade. I'm trying to get a little bit underneath it. And I can, of course, work towards the spine or away from the spine here, pulling those muscles out, just encouraging them to stretch a little. And again, going back and holding that shoulder blade and allowing that tension to release. Is that what it's doing? Mm-hmm. Nice. Afterwards, help her bring that arm across gently. No problems with the shoulder? Excellent. That means we did it right. Okay. Oh, cool. Now that was pretty fun, yeah? Okay, we covered quite a bit there. Hopefully some of that information was useful to you. Keep in mind, I am not a physical therapist or a massage therapist. I'm a kinesiologist, which I would say in some ways that's better than a massage therapist, but doesn't have the benefit of the experience and practical experience that a massage therapist has. What these methods are for you to maybe help alleviate some of the tension in your body, and very much for entertainment's purposes. Hopefully it's useful, educational, but of course it's not meant to diagnose anything. And so if you have something that's persisting, or these methods hurt at all or cause any additional problems, of course you should be seeing your doctor. And of course, always talk to a doctor before you start any sort of medical regimen. Right? And that all being said, that disclosure involved, I hope you did enjoy this. This again was to my good friend out there from training, and I want to dedicate this episode to those in the armed forces. Big shout out to them. We love all you men and women out there serving. Thanks for what you do. And another big shout out to all of my friends from basic training out there. I hope you're all doing well. And to my buddy and his dad, I hope you're feeling better, sir. Please get better soon. And I hope this was helpful. Take care. We'll see you next time. Bye-bye.
I lost some words there.
I did, yeah. 3, 2, 1. Hi, folks. Welcome back to RecSport Education. I'm Ryan Shanahan, and I want to do that a little differently. That helps. Get us started. Hi, folks. I'm Ryan Shanahan, and welcome back to RecSport Education. See, I didn't like that either. Hi, folks. I'm Ryan Shanahan, and welcome back to RecSport Education. Today's kinesiology episode comes courtesy as a request. Courtesy of a request. Okay. Yeah. Here we go. Take 3. Hi, folks. I'm Ryan Shanahan. Welcome back to RecSport Education. Today's what are words? The girls are just sitting there looking at us, just little puppies. All right.